22-year-old female patient, Mildred, is brought to the emergency unit by an ambulance. She complains of abdominal pains, nausea, and vomiting. There has been a buildup of these symptoms for about 2 days now. Her last meal was 24 hours ago, and someone could ask, could this be food poisoning? Let us zoom closely into her case and dissect each and every aspect of it. Hi, you are watching Files, and I am Dr. Thabo Mafa. Abdominal pain and vomiting are one of the common presentations seen in the emergency unit, and the causes for it can be similar sometimes. However, in the teenage years and early adulthood, one of the common causes that we see in an emergency is acute appendicitis. And what is it? Appendicitis is inflammation of the vermiform appendix, which is found in the right iliac fossa or the right lower quadrant of your abdomen. And the causes for it in most cases is a faecolith or a hardened stool, and sometimes could be caused by the presence of inflamed lymph nodes. Let us look closer into the possible symptoms a patient can present with. In most cases, these patients would present with severe abdominal pains. Sometimes it can be vague or even dull abdominal pain. It can be associated with a bit of fever, nausea, vomiting. And the pain sometimes can start right around the navel or the umbilicus, and whereby later on it could settle in the right iliac fossa or the right quadrant, lower quadrant of your abdomen. On examination of Mildred, what could be the findings? Her blood pressure was 112/83, heart rate of 109 beats per minute, which were normal. But her temperature was 38 degrees Celsius. She had tenderness in the right iliac fossa or the right lower quadrant of the abdomen. And to be more precise, this was at McBurney's point. The patient could have a positive Rossing's sign, and this simply means that when you palpate the left iliac fossa, it could elicit pain in the right iliac fossa, where the appendix is seated. Some patients would have a positive psoas sign or obturator sign, and this happens whenever the appendix is seated at the back of the caecum, which is part of the large intestine. If there is perforation, a patient could have generalized tenderness with rebound tenderness as well, and this we call peritonitis. How do we then investigate Mildred with abdominal pains and vomiting? We need to do bloods. We had to do a white cell count, which is an infection marker, and a CRP, which is an inflammatory marker, amongst other blood tests. We also did a urine test to check if it's not urinary tract infection, and also we did a pregnancy test just to exclude an ectopic pregnancy because she is a female patient. We also did an ultrasound of this patient just to see if there is inflammation of the appendix. Alternatively, you can also do a CT scan of the abdomen. Let us now talk about treatment. As soon as the patient arrives in the emergency unit, we put up a drip, we give them intravenous fluids. We also give them analgesia, that's pain medication. Also, we start them on antibiotics as soon as possible. We also give them antiemetics, that is medication to stop nausea and vomiting. Keep them nil per os, meaning that the patient shouldn't take anything, shouldn't eat or drink anything, because there is a high chance that they could be taken to theater. We have to consult a general surgeon as soon as possible. And the surgeon might opt for conservative management, meaning that treating appendicitis without really operating on this patient by means of giving them supportive treatment and antibiotics. However, doing so can put them at risk of recurrence of appendicitis in future. The definitive management for this condition is actually removal of the appendix. Now, let us imagine if Mildred never had appendicectomy, and that is removal of the appendix. What could be the complications? 1. You could have a perforation of that inflamed appendix, and that would be followed by peritonitis, meaning that inflammation of the whole intra-abdominal cavity, and that can be very dangerous. You can have an abscess formation around the appendix or on the appendix itself. And lastly, a patient could end up with sepsis, which is potentially fatal. Now, what was the outcome for Mildred? A 22-year-old female patient brought in by the ambulance into the emergency unit with abdominal pains and vomiting. On examination, she had tenderness in the right iliac fossa, and also on the bloods, her infection marker and inflammation marker were very, very high. The urine tests did not show any signs of pregnancy, and there was no sign of urinary tract infection. We've done a CT scan of the abdomen, which showed that she's got signs suggestive of acute appendicitis. We stabilized her in the emergency unit, started her on analgesia, and also some medication to stop the nausea and the vomiting, together with antibiotics. She was kept nil per os, meaning that she was not allowed to take anything orally, to eat nor to drink. And we consulted with the general surgeon, who did an urgent appendicectomy. So, in conclusion, early recognition of the signs and symptoms of appendicitis and commencement of treatment as soon as possible, together with surgical intervention, can save a patient's life. And thank you very much for watching.